Capuchin TV, Kitambulisho Katoliki.
It is Friday, the 19th of November. Good morning, dear viewer, and welcome to this Health Discourse with me, Sasha Elizabeth. Now, it has been our tradition to bring you this kind of talks just to inform you on different kinds of ailments, to be able to make important decisions about your health, and of course to seek medical attention where necessary. So today we are all set to inform you and delve deep into DVT or PE, that is deep vein thrombosis or thrombi, and pulmonary embolism. We are going to get to know this about these blood clots that are, of course, we'll get to know also the prevalence rate and understand deeply, as well as understand DVT and PE vis-a-vis COVID-19. Now in studio, as usual, I've got a guest, an expert in the medical field, and allow me to introduce him before we proceed. Dr. Ndirangu, welcome.
Thank you.
It's good to have you.
It's good to be here.
Please tell the viewer who you are and what you do, your line of duty.
All right. Dr. Ndirangu Mugo. I'm a medical officer at the Mater Misericordia Hospital, where I work in the Accident and Emergency Department, which is also called the Casualty or the Outpatient.
Thank you so much for creating time to be with us, to walk us through this important subject, especially in the COVID-19 pandemic. All right, dear viewer, you can be part of this conversation by sending us an SMS or calling our direct line on 0717-424-866. You can also drop your comment and your feedback on our social media platforms, Capuchin Television Network across all platforms, including YouTube, Facebook, and Twitter. So my name is Sasha Elizabeth, and welcome. Let's talk health. So to start off, let's start with the basics.
Yes.
What are DVT, or what is DVT or PE, and what's the difference between these two conditions?
As you rightly said, DVT in full is deep venous thrombosis. And what it means, these are blood clots that form in the legs, within the muscles, in the veins, in the legs, which are the deep veins. And then PE is pulmonary embolism, which are blood clots that are found in the lungs. These two are related in that DVT is usually the main cause for PE, in that when blood clots form in the veins in the legs, within the blood vessel walls, sometimes they can dislodge and they are sent into the circulation, into the heart, and from the heart they get into the lungs through the pulmonary arteries, and at that point it becomes pulmonary embolism.
So one must have a DVT for them to develop PE?
In most cases, yes. However, in a few cases, one may not necessarily have DVT to have PE, but DVT is indeed the main cause for PE.
Thank you so much. Now, please tell us how prevalent are these medical conditions, especially in Kenya and across the globe?
Thank you. There is not a lot of data about the prevalence in Kenya. However, globally, blood clots are the second leading cause of deaths after sudden heart attacks. And in the US, for example, 1 in every 1,000 people may have a blood clot. And it's been found that blacks do develop blood clots more than whites. So we would expect that the prevalence would be higher in African setting and even in our country, Kenya. And indeed, we see these cases quite commonly in our practice.
Thank you so much. Now, since the onset of the COVID-19 vaccines, the rollouts, there has been cases of blood clots that have led to suspension of some of these vaccinations temporarily. So it's been on the news. We've seen that what are some of the cases of, the causes rather, of these conditions, and how are they related to COVID-19?
Well, we've mostly had cases of pulmonary embolism related to COVID-19. So COVID-19, because of, it causes a lot of inflammation in the blood vessels, and also because of other things like low oxygen in the blood and dehydration that may predispose people to forming clots. Then we have had many patients who have developed blood clots in the lungs because of COVID-19. And it is estimated about a third or even more of the patients who die from COVID-19, the reason is because of blood clots. Concerning the vaccines, the risk of getting blood clots from the vaccines is much lower than getting blood clots from COVID itself. And that is why we are still encouraging vaccination, because the benefits do outweigh the risks.
Thank you so much for that clarification. It's very important. Now, how can one know, okay, besides COVID-19, before we go to the next question, are there any other practices that could put someone at a higher risk of developing DVT or PE?
Yes, there are mainly three things that could happen to cause one to have blood clots. Number one is damage to the blood vessel, because the blood vessel, when it is intact, it usually prevents blood clots through some mechanisms. So when that is damaged, for example, one has had a road accident or a fall or a sports injury, and has probably broken their leg, that would increase their risk for getting blood clots. Another thing that would increase one's risk is when blood is not flowing at the rate it's supposed to be flowing back to the heart. So this would be especially for people who are immobile, people who sit for long hours, people who are traveling long hours either via road or by air. Maybe you're going to a different, to another country. So because of the long sitting, usually more than 6 hours, then, and blood pools in the veins in your legs, then that increases your risk for getting blood clots. Another thing that would increase your risk would be recent surgery, of course, because of damage to blood vessels. And there are also other states that can increase your risk, such as pregnancy, whereby some factors that would cause increased tendency of the blood to clot would be increased, such as in pregnancy and in use of oral contraceptives. And some people have some hereditary disorders that predispose them to getting blood clots. And I think, as an important note, smoking is also a big risk factor for blood clots, because it does damage the blood vessels and increases one's risk significantly to get blood clots.
Oh, you mentioned injuries, or maybe during sports.
Yes.
So can injury to soft tissues such as sprains also predispose one to DVT or PE?
Yes, but then it also depends on the severity of the injury. If there is damage to the blood vessel, then there is some risk to developing a blood clot.
All right, thank you. Now, please tell us, what are these symptoms and signs that are an indicator that one could be suffering from DVT?
Thank you. I'll start with DVT, which is blood clots in the legs. Usually one may have pain in the legs, for example, in the calf, and you may notice some swelling. You may also notice some color change, some redness. And for pulmonary embolism, Usually the signs sometimes may not be as straightforward, but the main signs are chest pain that is usually sharp and stabbing. One may also have difficulty in breathing, either you're breathing fast or you're getting short of breath. One may also sometimes even feel dizzy. Some people may faint. Others more commonly may have a dry cough or even coughing out blood, which would be possible signs or other symptoms of pulmonary embolism. When one comes to the hospital and now we've put them maybe on a monitor, probably they would have a increased heart rate. We may also notice that their blood pressure may be low because the blood clot in the lung may start to cause problems with the heart pumping out blood, problems with breathing. So we may also notice a low oxygen saturation when we connect the device we use to check the oxygen levels on their finger. So those are some of the signs that we may be able to pick out in a hospital setting.
So the best way, the best tip to take after noticing some of these symptoms and signs is to seek medical attention, right?
Yes, that is right.
So now, how are these conditions diagnosed? Is there treatment for them? Can someone be fully treated and be declared safe from DVT or PE?
Yes. And it is important to be able to diagnose this blood clots either in the leg or the lungs quickly, because if not diagnosed, then one could possibly even die from those conditions. So in terms of diagnosis in the hospital, the main test that we do is called the D-dimer test, which is usually a blood sample that's taken, and then it's analyzed in the lab. And if it is increased, then we may also decide to do what we call a Doppler ultrasound, which is a type of scan that checks for the blood clots in the veins of the legs. So it's able to look at blood clots right from around your foot up to even your groin region, and it would be able to show us where the clot is. For pulmonary embolism, we may require to do a CT scan of the chest, which is called a CT pulmonary angiogram, which will also help us to see the location of the blood clot and also to assess the severity of the blood clot. Some people may have a massive pulmonary embolism. Other people may have a less severe pulmonary embolism, and that will help assist us to treat these patients. So once we have confirmed that you have a blood clot, the treatment would be blood thinners, which usually we can give them by mouth, which is orally, or we can give injections. So which would mean one may need to be admitted to the hospital, especially for patients with pulmonary embolism, because we need to monitor them closely to ensure that they do not get any further complications. But for patients with deep vein thrombosis, oftentimes we discharge them home on the blood thinners, and they may take them for a period of up to 3 months as we continue to follow them up.
Quite an in-depth explanation right there. Okay, so now after one has been treated, the DVT patient has been treated, what is the probability that this patient will have a relapse of the same condition?
Well, after one has been successfully treated, maybe for a period of 3 months, usually the treatment for 3 months is for those patients with DVT whom we know that they had a cause. For example, one had a previous surgery that directly contributed to them getting that blood clot. So for such patients, they tend to be on treatment for a shorter duration. But there are other patients, for example, who get clots because of things like cancer, and maybe they are on treatment for a long time because of the cancer, and those patients may tend to be on treatment for longer. But once you get a blood clot, there is a small risk that even after maybe the 3 months of treatment, that you can develop another clot. And if you're exposed, for example, if you're still immobile, you're sitting down a lot, maybe you're still using contraceptives, or you have other risk factors, then there's still a possibility that one can get
a relapse. Thank you so
yes.
much. Now it's time to take a breather, and we'll be right back with more on DVT/PE. Stay tuned.
Welcome to Mata Misericordia Hospital, Buru Buru Clinic for holistic medical services.
This is Buru Buru Medical Center, which is part of Mata Hospital. And at Buru Buru, we essentially offer services offered in Mata Hospital.
We are located in the first floor failing building above Quickmart. In Buru Buru, we have general consultation Monday to Friday. Saturday and Sunday they are still available. We still have specialists. On Tuesday and Thursday we have gynecology clinics running from 8 a.m. to 2 p.m. We have a pediatrician clinic running on Wednesday at 8 a.m. to 2 p.m. We normally have a wellness, which we normally do from Monday to Sunday. Every day, feel welcome, you can come.
Experience the difference in our wide range of quality, responsive and compassionate healthcare services.
We have very highly skilled and qualified staff running the units. We offer services including doctor's consultation services, which is the general doctor in the outpatient unit. We also have laboratory services and pharmacy services. On particular days of the week, we have specialized clinics, which include the physician clinic, where we have our hypertension and diabetes patients followed up. And then we also have the obstetric gynecology clinic, which is run on Tuesdays and on Thursdays. We have the pediatric clinic, which is run on Wednesdays. And then we also have the ENT clinic, where we have the ENT doctor coming in, and that is run on Fridays in the morning. There is also a pediatric surgery clinic, which is also on Fridays.
Our child welfare, we normally do them on Wednesday, Friday, and Saturday from 8 a.m. to 2 p.m. We have our ENT clinic Friday, 8 a.m. to 10 a.m. We normally have nutrition services on Tuesday to Thursday, and we have extended our radiology services from Monday to Friday to Saturday nowadays. Initially, we were running up to Friday, but currently going up to Saturday.
We deliver all our services with utmost diligence, integrity and equality.
We see everyone at the Buru Buru branch. We do not discriminate against anyone, either on race, on religious grounds, or disabled people. You are all welcome to receive services at our branch.
Be assured of privacy. We normally keep to our ethics. We are so compassionate to our clients. Integrity is all over. So when you come, we feel you, and that is why you can see nowadays we are running, like every Friday we are having a special clinic. Currently we are running the breast clinic. Next month we are coming up with clear colon screening. So don't forget we are Christ-centered. When you come, and we don't segregate because you are a Christian or a Muslim or Hindu. We treat every client as equal as any other.
All right, welcome back, and we are glad that you are continue to keep us company here on Health Friday, right here on Capuchin TV. And today, as we briefed you earlier on when we started our first session, we are talking about deep vein thrombosis and pulmonary embolism. And with me in studio is Dr. Ndirangu Mugo, a medical officer at Mater Misericordia Hospital. So we move on with the discussion. Remember, you can continue sending your feedback, and I'll be sampling them before we wrap up this discussion. And yeah, cases of blood clots. It has even happened. We've had new parents or just mothers who have developed such conditions maybe immediately after birth. I know you mentioned some of the things that can predispose someone to blood clots, but you did not touch on that aspect, because there have been cases of mothers who give birth and then unfortunately we lose them, and then it turns out that they developed blood clots. Could you please give us some more insights on that?
Yes, that is, it's true and unfortunate. As we had mentioned earlier, pregnancy does increase one's risk for developing blood clots. And in addition to just being pregnant, of course, there is the hormonal changes that do cause, predispose one to blood clots. But in addition to that, sometimes if a pregnant mother also is not taking enough fluids and they become dehydrated, that increases the risk further. If they are not walking around a lot, if they are not active, and sometimes it's a challenge because, of course, with pregnancy, you've added weight, the needs for the mom and the baby are increased. So it becomes a challenge for them to, and sometimes because of also pain, because of the growing baby, it might be difficult for them to walk around a lot. So that increases the risk further. So there are some who do develop blood clots, but because during pregnancy, mothers are supposed to be attending antenatal clinics. So as they attend the clinics, then these issues are able to be picked up early, and they're able to get treatment on blood thinners, and that's able to prevent further complications. Before I get to after pregnancy, even at delivery, cesarean sections have been found to increase significantly the risk of getting blood clots. As we had said, surgery because of damage to blood vessels, and even after surgery, patients are usually less mobile, so that increases the risk further for getting blood clots. So a pregnant mother who probably has undergone a cesarean section, in a facility like ours at Mater Hospital, they do get blood thinners at a lesser dose, which we call a prophylactic dose, just to prevent possible blood clots. And for the ones who, unfortunately, if one develops a blood clot, then they will have to be treated on blood thinners for a while to be able to prevent any further complications and even death. And thankfully, most of them are able to recover, and we encourage them as well, in addition to the treatment, to be mobile, and we are able to follow them up closely in case of any issues.
So this condition can actually be detected as early as during these prenatal clinics?
Yes, that's right.
Okay, thank you so much. So please tell us, do all patients get to recover? That's those who suffer from DVT and even pulmonary embolism?
Yes, a good number of the patients, the majority, do recover who get DVTs, blood clots in the legs. However, a lesser number do recover in blood clots in the lungs, because they tend to be a bit more serious than the blood clots in the legs. And that's why we do keep an eye more closely on the ones who have pulmonary embolism. And that's why, as I said, we may need to admit them for some period of time. However, it's important to also say that we also need to address what was the actual trigger for the blood clot. So if the patient had an infection, for example, HIV or TB or COVID, that also needs to be addressed. So if the patient was on hormonal estrogen therapy or oral contraceptives, then that needs to be stopped. So blood thinners are the main part of the treatment, but we also need to address the other issues so that we reduce the risk for developing a subsequent blood clot.
Thank you so much, Dr. Mugo. Now, we mentioned in our first session some of the signs and symptoms
Yes.
of DVT and PE. What are these conditions that could present similar signs and symptoms to those of DVT and PE?
Thank you. I'll start with the DVT, blood clots in the legs. Usually swelling in the legs may also be because of an infection. It may be an infection in the superficial tissues, what is called erysipelas, or it may be an infection in the deeper tissues, which is called cellulitis. Sometimes even just a muscle sprain or strain may look like a DVT, and that's why we have to do the blood test and possibly the leg ultrasound to be able to make a diagnosis of what is actually ailing this patient. For pulmonary embolism, we mentioned the symptoms would include most commonly chest pain, dry cough, coughing out blood, and difficulty breathing. So other conditions such as pneumonia, which is infection in the lungs, can also look similar to pulmonary embolism. Even a heart attack, because of the chest pain and the shortness of breath, can look like a pulmonary embolism. Yeah, so those are some of the things that we would need to investigate as the medical fraternity to be able to differentiate and to treat the patient as appropriate.
Thank you. Now, what are some of the measures that one can take to prevent DVT and PE?
Thanks. The old adage that prevention is better than cure is quite dear to me. And for blood clots, just as we mentioned the risk factors, so we would encourage, for example, some of my friends and I will be going on a trip tomorrow to Meru, God willing. And we hope to have some stops, not just to enjoy the scenery along the way, but hopefully to prevent blood clots.
Wow.
So
I hope you tag along our camera person, Ivan Savannah.
he's much welcome. Thanks. So if you're traveling for long and people go to Western and Kisumu, then those breaks are not just to get a mandazi and samosa, but also to make sure that there's good blood flow returning to your heart, and that's able to prevent blood clots. So in addition to that, generally an active lifestyle, so physical exercise, and diet, especially a diet that's low in fatty foods, because cholesterol, when it accumulates in your blood vessels, also increases your risk for blood clots. So we would encourage people to be a bit more active. So either go to the gym, you can do home workouts, you can take a walk, go for a jog, go for a run, and those are things that would help to prevent blood clots. Another important thing would be there are lots of people who are smokers, and as we said, smoking increases one's risk significantly. So smoking cessation would also go a long way in preventing blood clots. So for patients who've been admitted to hospital and who've had, even patients who are in hospital, they shouldn't just stay in bed all day. If they're not too sick, they should move around, at least to reduce the risk for developing blood clots.
So patients can actually develop blood clots while they are in hospital?
Yes, that's right.
Okay. All right. So maybe you tell us more on these the practices that one can really adopt maybe at home. We can talk of these people who have already been maybe hospitalized, they
Yes.
have already seen the red flags and they have sought out for medical attention. And then we have this other lot that is at home. Are there any other ailments, for instance, the chronic ailments like diabetes?
Yes, of course. Diabetes and hypertension, for example, can also cause problems with the blood vessels. And we also mentioned some conditions like HIV and tuberculosis, and most infections would increase one's risk for getting blood clots. So it's important that if you're diabetic, that you take your medicines consistently, and in addition to your medications, then you also adjust your lifestyle accordingly to be able to further reduce the risk. Then that would also mean that if probably you're on oral contraceptives, then you might need to look for an alternative mode of contraception to further reduce your risks. And as well, if there are any concerns that develop, then it's good to follow up with your medical practitioner.
Great. Now, as we wind up, because time is against us, please take this opportunity and talk to the viewer. Give them your parting shot and your advice in as far as DVT and PE is concerned.
Thank you. Blood clots is a common issue, blood clots in the legs and in the lungs in our setup, and can be a serious issue if not detected early and treated appropriately. So if you notice swelling of your leg, pain in your leg, change in color, or you're having difficulty breathing, coughing out blood, severe chest pain that's sudden in onset, then we advise you to make your way to the nearest hospital so that we can evaluate. And finally, as we said, prevention is better than cure. So live an active lifestyle, stop smoking, eat healthy, exercise, and treat whatever other infections or conditions that you may have as appropriate. And I trust that God will keep us.
Wow.
Yes.
Thank you so much. Thank you for creating time to come and enlighten us on DVT and PE, and we really appreciate that. Yeah, time has been really limited, and there's quite a lot to be explained under these medical conditions, but we create more time in future, hopefully, and get to understand more about this. Thank you so much, Dr. Ndirangu Mugo. Now, you can also, for more inquiries, call the number that is popping on your screen, and you can as well also continue sending your feedback. We are sorry, the schedule is quite tight because there are so many live events lined up for today, and we would like, really would have wished to read out your comments and feedback and respond to your questions, but we'll be sure to do that in our next session on Health Discourse, one of these Fridays. Now, I'd like to thank the entire team. Our camera person has been Ivan Savannah, and I'm really still lauding and recommending that Dr. Mugo would tag him along. He's a very fan of Nyama Choma. All right, and our visual mixer has been Edna Mumbi. As usual, our sound mixer is Frederick Ocheng, aka DJ Fredox, and our transmission person is Peter Mwangi. Thank you all for the efforts. Thank you all for contributing towards this live show. And as we close this discussion, I'd like to take you to the flyover, that is the border of the Catholic Diocese of Nakuru and the Archdiocese of Nairobi, where there is a homecoming celebration of the newly appointed Archbishop of the Archdiocese of Nairobi, that is Bishop Philip Anyolo Subira, who there's a team there from Capuchin TV who are ready to bring you live events and what's happening in the homecoming celebrations of the new Archbishop of the Catholic Archdiocese of Nairobi. My name is Sasha Elizabeth, and I hope you enjoy the rest of your day. Have a great weekend. Goodbye.
Welcome to Mater Misericordia Hospital, Buruburu Clinic for holistic medical services.
This is Buruburu Medical Center, which is part of Mater Hospital. And at Buruburu, we essentially offer services offered in Mater Hospital.
We are located in the first floor failing building above PICMAT. In Buruburu, we have general consultation Monday to Friday. Saturday and Sunday, they are still available. We still have specialists. On Tuesday and Thursday, we have gynecology clinics running from 8 a.m. to 2 p.m. We have a pediatrician clinic running on Wednesday at 8 a.m. to 2 p.m. We normally have a wellness, which we normally do from Monday to Sunday. Every day, feel welcome, you can come.
Experience the difference in our wide range of quality, responsive and compassionate healthcare services.
We have very highly skilled and qualified staff running the units. We offer services including doctor's consultation services, which is the general doctor in the outpatient unit. We also have laboratory services and pharmacy services. On particular days of the week, we have specialized clinics, which include the physician clinic, where we have our hypertension and diabetes patients followed up. And then we also have the obstetric gynecology clinic, which is run on Tuesdays and on Thursdays. We have the pediatric clinic, which is run on Wednesdays. And then we also have the ENT clinic, where we have the ENT doctor coming in, and that is run on Fridays in the morning. There is also a pediatric surgery clinic, which is also on Fridays.
Our child welfare, we normally do them on Wednesday, Friday, and Saturday from 8 a.m. to 2 p.m. We have our ENT clinic Friday, 8 a.m. to 10 a.m. We normally have nutrition services on Tuesday to Thursday, and we have extended our radiology services from Monday to Friday to Saturday nowadays. Initially, we were running up to Friday, but currently going up to Saturday.
We deliver all our services with utmost diligence, integrity and equality.
We see everyone at the Buruburu branch. We do not discriminate against anyone, either on race, on religious grounds, or disabled people. You are all welcome to receive services at our branch.
Be assured of privacy. We normally keep to our ethics. We are so compassionate to our clients. Integrity is all over. So when you come, we feel you, and that is why you can see nowadays we are running, like every Friday we are having a special clinic. Currently we are running the breast clinic. Next month we are coming up with clear colon screening. So don't forget we are Christ-centered. When you come, and we don't segregate because you are a Christian or a Muslim or Hindu. We treat every client as equal as any other.